recent news story out of Victoria claims some vets are charging upfront fees of $2,000 or more for emergency treatment for things like snake bites to dogs, and it has some pet owners up in arms. So we wanted to see if this was price gouging by a few or a legitimate claim. Dr. Ingrid Goodman from Sydney's Animal Referral Hospital explains.
It's normal for any procedure, especially at emergency centres, and it protects the vets and the hospital, because sometimes, and unfortunately, you just need a couple of cases to burn you for this to happen, where you'll do everything that you can for an animal and you might not get a very good result. For example, the animal might die despite everything that you try and do, and then you have owners that will refuse to cover the costs or to pay the bill.
How would they refuse to pay the cost of the bill? I mean, if they've brought their animal in, they obviously love it enough to...
Oh, when it settles into their mind, this is how much it really is, and perhaps if they realise they just don't have that sort of liquidity at hand to pay that bill.
Yeah.
It does get a lot of people in strife.
Okay, so what's involved? Why is it so expensive to treat, say, a snake bite?
Right, well, we see snake bite quite commonly here at the Animal Referral Hospital, and it does depend a lot on what type of snake has bitten the animal. If we know for sure that the snake was a brown snake, for example, we can use brown snake antivenom, and that is cheaper than the multivalent antivenom. So when you don't know what snake it was, you're forced to use the multivalent serum, and that is triple the cost almost. So to the client, we're charging them like $900. And that's just for the vial of antivenom. That doesn't even cover the cost of putting them on IV fluids, or the cost of being hospitalised for 24 or 48 hours, or even covering, if we need to check if maybe they need a blood transfusion or plasma transfusion to help them get over that envenomation, or even if they need antibiotics afterwards. That $900 is just for that one vial, and in some cases dogs need multiple vials. So
emotionally, it must be very hard if someone comes in and discovers how much all the treatment's going to cost.
It is, and it is really hard. It's something that emergency vets have to face all the time in emergency practice, because emotions are running high.
As you can see, the vets and vet nurses at the Animal Referral Hospital in Sydney are a dedicated bunch of people, and as Dr. Ingrid explained, emergency veterinary care can be expensive, and it's not unusual to sometimes be asked for some kind of upfront part payment, but there are several ways to help ease the pain on the hip pocket. Just ask your vet about pet insurance next time you see them, and don't forget to ask them about the VET Pay service. Sounds like a great initiative that helps vets and pet owners.